welcome everybody to our program today, Pain Management for Inflammatory Arthritis. I'm Jane, one of the Arthritis Educators. So before I start today, I would like to record our sincere thanks to Pfizer New Zealand for their support of these webinars. So today we'll just start with a little bit about inflammatory arthritis generally, a little bit about medical management, but then in particular we're going to be looking at self-management or self-care, which is a really key part of pain management. So the program will run for about 20 minutes and then there will be time for questions. So inflammatory arthritis are autoimmune conditions, basically meaning that the immune system becomes confused and attacks normal healthy cells in the body. This creates inflammation and locally in the joints, swelling, heat, redness, pain and stiffness. We will touch on shortly the whole body symptoms that are also created through the levels of inflammation. But just looking locally again at the joint, you can see a normal joint there which has a lot of different structures to it. In the middle, osteoarthritis. Now osteoarthritis isn't a form of inflammatory arthritis. There may be some localized inflammation and a number of other joint changes that will happen. But you can see the rheumatoid arthritis joint. Rheumatoid arthritis is one of the more common forms of inflammatory arthritis, and you can see the swollen, inflamed synovial membrane, which is a key feature of inflammatory arthritis. If these conditions aren't well managed, long-term damage can happen to the joints from this inflammation, including bone erosion. So there's a number of different types of inflammatory arthritis. As I mentioned, rheumatoid arthritis is the most common. Other reasonably common conditions are psoriatic arthritis, AS or ankylosing spondylosis, lupus, reactive arthritis, juvenile idiopathic arthritis, which affects children and young people, scleroderma, and others. So as I mentioned, the localized symptoms in the joint, pain, stiffness, swelling, but there are also impacts on general well-being, which include fatigue, often high levels of fatigue, loss of appetite, weight loss, generally feeling unwell. These conditions usually cycle through flare-ups and remissions. It's not always clear what the flare-ups, why they happen. Some people do notice patterns. Sometimes it's because of overdoing things from a physical point of view, but it also may be related to stress. Remissions also can happen. Other organs in the body may be affected through these conditions, through the inflammation, including the cardiovascular system. Also the eyes may be affected, uveitis, so an inflammation which causes itchy, sore, red eyes and maybe blurred vision. Our emotional health and mental health can also be affected, with many people feeling down and depressed. So diagnosis is important as early as possible so treatment can be started, but it is a bit of a process often. Many of these conditions present in a similar way, so it can be a bit of, can take a bit of checking out to actually clarify and have a definitive diagnosis. Blood tests are an important part of the diagnosis process, including things like inflammatory markers. X-rays, ultrasounds and MRIs may also be used, and joint aspiration, where a small amount of fluid will be taken from the joint and examined under a microscope to help to clarify the diagnosis. We don't know all the causes of these inflammatory autoimmune conditions. It may be that there's some genetic factors involved. For some people, hereditary, for some not. Prior infections may be a trigger for some of these conditions. We do know that smoking increases the risk of rheumatoid arthritis by about 40%. It's really important as part of pain management to have a toolkit of strategies and to manage pain. And we'll, as I mentioned, touch on the medical management, but then really focus on the variety of lifestyle or self-care ways that we can work at managing pain and some of the other issues, including fatigue, that can be part of these conditions. So we'll look a little bit, of course, at being active, about exercise, nutrition, some complementary therapies, and other aspects of pain management. So it's important to have a team approach involved in your care. And the first point of contact, of course, is your GP, practice nurses also. Generally, people should be managed either through, directly through a rheumatologist, either privately or through the DHB rheumatology service. These, the DHB rheumatology services always have a rheumatology nurse attached to them, and she's a really great person to have her contact details, to ask questions between appointments, to check on things like your medications. You may also be referred to a physiotherapist, a podiatrist, or orthotist if your feet are involved, a hand therapist. Occupational therapists can help with activities of daily living, assistive products and devices that can also be helpful. Some of you may be referred to surgeons. If it's a child or young person, the pediatric rheumatology team would be involved. And of course, if other organs are involved, you would be referred to the relevant specialist, for example, a cardiologist. Don't forget about arthritis educators. We're part of your health team. We are available to support you to understand your diagnosis and to support you developing and following through with your pain management plan. Of course, the most important person in this team is you. And our aim in these programs is really to help you, support you to be in the driving seat. So communicating with your health professionals to develop that partnership relationship is really important. So being clear about what you've been experiencing. Some people find it useful to keep a journal of their symptoms, communicating with your doctor, writing down your questions before your appointments, taking someone with you can be really helpful as a support person, as another pair of listening ears, really understanding about your medications. And of course, it can be stressful attending appointments. You only have a short period of time, and it's very common, of course, to remember your questions after you've come out of your appointment. So that's where you can follow up with the nurses, either your practice nurse, the rheumatology nurses I mentioned, and also the pharmacist, where you collect your prescription medications. They are also really useful people to communicate with about any issues or concerns around your medications. So medications are a key part of medical management for inflammatory arthritis conditions. And the focus of the medications is really to reduce the levels of inflammation. So you're looking after your health and well-being now and for the future, and preventing joint damage and damage to other organs and systems in your body. So DMARDs, methotrexate is a very common DMARD that may be prescribed for these conditions. And the aim of DMARDs is to reduce the activity of the immune system, and which is attacking and damaging the healthy joints. Corticosteroids are also commonly used. Some of you will know prednisone is very common in use, sometimes especially during that diagnostic process. So it's working on reducing the inflammation. Corticosteroids may be also used alongside things like DMARDs because they have a bit of a time before the impact kicks in. So sometimes corticosteroids are also used as the DMARDs before they're fully functioning. Biological therapies are another level of DMARDs. Not everybody may need them, but they're more recently developed in the last few years, and they block substances in the blood and joints that cause the inflammation. So again, of course, focusing on reducing the inflammation and halting joint damage. Topical non-steroidal anti-inflammatory rub-on creams and gels may also be helpful for that localized pain relief. So often people also, of course, want to know about complementary therapies. As an organisation, our aim is to support people with researched information around these kind of herbal products or other complementary or alternative options. Arthritis Research UK have studied, for example, fish oil and given it a 5 out of 5 for effectiveness for inflammatory arthritis conditions. But the amount of product that you need, the actual omega-3, the DHA or the EPA, is really important. So it's a good idea to get some professional advice, perhaps from a naturopath or your doctors, around what's the level that's okay or therapeutic for your condition. But the other key thing around, if you're choosing to take any of these kind of products, including fish oil, that you check with your doctors or the pharmacist, not the salesperson, the pharmacist, if these products are okay for you to take, considering perhaps your other health conditions and also other medications you are on, because it can be that there can be serious impact or effect. So it's really important to check those things out. So now we'll move on to talking more about, as I mentioned, what is often called self-management. And these are the lifestyle things that are actually really important for our health and well-being generally, but become really significant when we're living with long-term health conditions like inflammatory arthritis. So keeping on moving, and we'll talk about how in a moment, is really important. But of course, it's really difficult if you're living with pain and fatigue. It's very tempting to want to move less. That increases the weakness in your muscles, and that can add to the pressure on the joints and actually increase your pain and fatigue. So it's about breaking that negative cycle, really. And the important thing also about keeping active is it's not just the physical aspects, but it's also about supporting your emotional health and your mental well-being. When you're moving and being active, you're supporting the release of the feel-good hormones, endorphins, which are really, really key in pain management and your well-being generally. So you're aiming for exercise that includes strengthening, stretching, and aerobic. And sometimes it's really difficult to know where to start. Some of you, I'm sure, are already engaged in activities that you find really helpful. And I know we've had comments from a number of people, of course, during these recent lockdown times where their normal hydrotherapy or water exercise, for example, hasn't been available, or the normal low impact group classes haven't been available. But hopefully we're going to gradually see the return of some of those programs. Certainly exercising in a group can be really supportive for your confidence and motivation. So other kinds of activity which you may enjoy include walking, really important if you're walking to have supportive footwear that's got some cushioning and strengthening in it. So it's working on finding what's helpful for you and what keeps you motivated. If you're really lost about where to start, the Green Prescription Program can be a really useful first point of contact. It's a national program, but it is provided differently in different parts of the country, but you can ask your practice nurse or GP to refer you to the Green Prescription, and you will you should get a phone call and at least some information around what's available in your community and what kind of exercise would be okay for you considering your health conditions. We also have a DVD on our website, and that's a good option just to have something to do at home through the wetter, colder times of the winter or as part of your exercise program. There's a lot also of free YouTube videos around a whole variety of different levels and different types of exercise. Eating, diet, nutrition, really important again, and we have a lot of questions around this aspect of well-being. A lot of people with inflammatory arthritis do find that there are certain foods that highlight their symptoms. So obviously it's very different for everybody and it can be a bit of trial and error. But the key messages from us, there's no actual magic, if you like, arthritis diet, but the key messages include eating regularly whole foods. Whole foods obviously include things like fruit and vegetables, whole grains, and whole grains which are more high fiber, some healthy protein. Fish can be really great because it contains omega-3. Just those tins of oily fish can be really 2 or 3 times a week can be a really good, cheaper option. Things like tuna and sardines, mackerel, but try to go for the tins that are in the spring water rather than oil, because the omega-3 is actually in the flesh of the fish, and if the tin of fish is in extra oil, it's just adding more calories. Also, protein through milk, yogurt, and things like milk, yogurt, and cheese. There's a lot of other ways that we can also relieve pain and stress. It's really important to have some strategies to manage stress. Stress is a really key component of producing inflammation in the body and adds to our levels of pain. So I'm just going to touch on a couple of aspects of the information that we've got here on this slide. Distraction, really, really key way to manage stress and pain levels. And that's just about being absorbed into activities that are really enjoyable and absorbing for you. And that's obviously different for everybody. It might be reading, listening to music, playing music, just finding and making sure that you keep some time every day, some time and energy to be involved in that kind of activity. Learning relaxation techniques and deep breathing, really, really important strategy also. Good idea to just check your breathing as you go through the day. Often when we're living with pain and stress, we're breathing very shallowly up here. You need to aim for your breathing to breathing in so that the oxygen's getting right down into the bottom of your lungs. And so if you're holding your hands against your lower abdomen, you should notice that's where you're moving in and out when you're breathing, which means that your energy, it will help your energy levels and, as I say, your anxiety and stress and pain levels. Managing fatigue is very key and often a big aspect, as I've mentioned, of living with inflammatory conditions. Some people really struggle with the idea of pacing. what you're aiming for with pacing is to avoid the crash and burn cycle, which some of you will recognize. It's something that can happen if you get up, say, in the morning and you think, oh, this is a good day today, and just go for it, whatever that means for you, and end up flat on your back for 3 days. It's a very negative cycle to be in and can be really create a lot of stress and a lot of making of lists, if you like, about things you feel you can't manage or do anymore. So it's really thinking about how you can prioritize, delegate things, say no, learn to say no, just don't do it. So really thinking about things like what around that, but also around what time of the day is better for you to manage perhaps whatever the heavier tasks, whatever that means for you. Everyone has different roles and responsibilities. So these kind of strategies obviously vary depending on how that is for you. Posture is again something to be aware of. Sometimes when we're living with pain, we tend to move or sit or walk in a way that puts stress and pressure on other joints and can also create more fatigue. There's a lot of devices and aids around that can be really helpful for joint protection. Mentioned about shoes being supportive and having cushioning. You may find having inserts in your shoes is really useful. If your hands are affected, bracing can be helpful. Also, wide handle kitchen tools are useful, easy reaches, so you don't have to bend down. There's a whole range of products available online at the moment, but I think stores are also opening that sell these kind of products again. Okay, so I'm just going to start winding up now before we get to the questions. So just a couple of things from me. So we're aiming to keep you in the driving seat. And so just a reminder that you can call our 0800 phone line, 0800 663 463, and speak to an arthritis educator to understand your diagnosis and to get support with your pain management plan. You can also email us through info@arthritis.org.nz. We have more information around all of the topics that I've touched on today on our website and also our YouTube channel. So just a couple of other things from me, and then we'll get to the questions. It would be really, Arthritis New Zealand is a charitable trust, so it's really important for us, and we really appreciate public donations to enable us to continue our work, including these kind of programs. So we would really appreciate it if you could visit our website and use the donate button to make a donation. We would also really appreciate, after these kind of programs, we send out a survey, and it would just be really helpful and for us if you would take the time to fill that in so we can continue to improve the programs that we offer. Okay. Okay, so we've got a question here. Can you please talk more to the foods that are known to be inflammatory? Yes, it's a really big issue. Oh, and I thank you for reminding me. I should have actually said that we know that, for example, sugar is, I'll just put this down again. We know that sugar, and also a lot of foods that are highly processed and highly refined and often don't have a lot of nutrition, can also be inflammatory in the body. So that's why the main message, I guess, is whole foods. And one of the pieces of information on our website that I'll refer you to is Jennifer Bowden. She's a registered nutritionist, and on our website in the news section, I think it is at the moment, her article on how to eat and what to eat is a really useful resource. Also, there's a video clip there from her. So yeah, have a look at that as well. Okay, Sandra's asking, I have a degenerative spine. Is that considered arthritis? Do you have any ideas how to protect or preserve it? Yes, sometimes, yeah, different words are used, which is really confusing, isn't it? And we try to avoid words like degeneration, but really to know if that's arthritis, it's a word that's often used around arthritis, but it's perhaps useful for you to ask your doctor, what are they talking about when they're talking about arthritis? Um, and then there's a number of things, you know, that could be useful. It could be important to see a physiotherapist to understand what kind of exercises are okay for you. Also, footwear would be really important, because what we're wearing on our feet, it's not only about protecting our feet, but also our joints all the way up, our knees and hips and spine. But yeah, I think I would suggest that you ask your doctor for some more information around the diagnosis, what they're talking about when they're using those kind of words. Somebody's asked also, I think, about gloves, compression gloves. Yes, compression gloves, people often find really, really helpful, because it's like when you're massaging a joint. Compression gloves or knee supports can be really helpful around improving the circulation. They can add a bit of warmth, especially in this weather, you know, that we're moving into the colder weather. I know for some of you further down the country, it's really cold today. So yeah, people do often find there's a number of different varieties of fingerless compression gloves, and people often do find them really, really helpful. So Christine has been living with and managing RA for a number of years, but she's finding that her feet are sore after she's been doing her walking. So there's a number of things that could be helpful there, like your footwear, for example, making sure that you've got footwear. And I would suggest, because it sounds you've done really well managing all this time, but I think it would be really worth you seeing a podiatrist, perhaps, to make sure that the footwear you've got is really the best. If it's useful to have some inserts in your shoes, also perhaps some particular exercises, specific exercises. I mean, we do have some of those kind of things on our website, but I think sometimes it can be really worth you know getting that specific guidance. Also, I'm wondering, Christine, about trying some different kind of exercise, whether water exercise is an option. But certainly I think sitting with your feet up when you've done your walking, looking at your footwear, getting some exercise, doing some specific feet exercises, maybe using some foot soaks. But yeah, looking at, you know, cycling, and I don't mean you have to get out on the road and cycle, but exercycle, or just some different ways perhaps to take that load off your feet could be helpful. So Joan, is it arthritis if pain moves around your body from knees to back? Rheumatoid arthritis, or inflammatory arthritis, but particularly rheumatoid, I guess, are what they call bilateral, and it's usually that the joints on, if it's hands, they're both hands, if it's feet, it's both feet. Osteoarthritis, and I'm not sure if you're talking about what kind of arthritis you're talking about, but yeah, so the pain moving around the body, I mean, it depends what kind of arthritis you've got. So if you've got some aches and pains, Joan, and you're really unclear about them, it would be perhaps a good idea for you to check with your doctor. And Denise, major joints and also major pain in lower back. So, oh, there's a lot of things in there, Denise. So sounds like you're saying you've got OA, and so I honestly would suggest, Denise, that you ring and speak to one of our educators, because there's a number of things in there, and sometimes it's just really useful to be able to talk through those various things that you're concerned about, and getting support around whether it's following up with doctors or just supporting you with some other options around your self-management and your medical management. So I really encourage you to do that. I think that's all the questions we have for now. But if you need, as I say, and as I've said, particularly to Denise, if you need more information and support other than what you've heard today, please do ring our 0800 line so you can have a more in-depth conversation around the issues that are concerning you. Okay, that's good, Denise. I think that's a good idea. Okay. Thank you, everybody, very much for being part of today, and go well, and please use those other support and information opportunities. I'm not sure if I mentioned the support groups that are available on our social media that are really helpful to share information and tips with each other, either with people living with the same or similar kinds of arthritis to you. So thank you again, everybody, and see you next time. Thank you.